When someone is diagnosed with a neurocognitive disorder, such as Alzheimer's disease, they may experience repetitive speech, agitation, confusion, or they may decline activities necessary for their own well-being. If you are part of the close circle of someone experiencing this condition, this video is for you, as it offers tips to help you respond with confidence to such situations. It follows the video capsules Living with a Neurocognitive Disorder and Strategies to Communicate in a Supportive Manner with a Person Living with a Neurocognitive Disorder. Here are 3 general strategies to keep in mind to interact positively with people diagnosed with this condition and foster their collaboration. First, validation involves reflecting the emotions a person is experiencing by naming them and showing empathy. To do this, it's important to meet the person in their own reality, which is no longer necessarily the same as yours. To better understand what they are experiencing, you can, for example, ask simple questions about themselves or their situation. It's important to avoid contradicting or correcting them, even if what they say seems inaccurate. Diversion is a second strategy that can be combined with validation. This strategy consists of diverting the person's attention by redirecting it to something positive. For example, by talking about happy events in their past, topics that interest them, or suggesting an activity that they enjoy. Finally, taking a step back from the difficult situation can also help. This strategy involves taking time out to observe the person and their environment, to identify elements that could be affecting him or her. These could be fatigue, pain, fear, noise, or bright lights, or basic needs such as hunger, thirst, or having to go to the bathroom. Even when time is short, it's a good idea to act on these elements first and adapt to the person's rhythm, since trying to go faster will often result in more resistance. Now, let's see how these strategies can be applied to real-life situations. When the person is experiencing memory loss, they may ask you the same questions repeatedly. For example, about the date of an appointment. Since this behavior often stems from anxiety, the impatience you may feel may only exacerbate the repetition. So it's important to simply give them the information again each time they ask the question. For example, by showing them the date and time of the appointment on the calendar. You can also identify what might be making them anxious and validate their emotion. For example, by saying, "It's stressing you out, isn't it, having to go to this medical appointment?" Diversion can also be used, for example, by suggesting that they look at photos. Sometimes, the emotions experienced by a person with a neurocognitive disorder can lead to agitation or even aggressive reactions. Keep in mind that memory loss and confusion can be frustrating, even frightening, for the person experiencing them. Stay calm and reassure the person in a soft voice with slow, steady gestures, letting them know you're there to help. You can also validate their emotion by saying, "I can see that you're not happy." You should also be alert to any physical or psychological discomfort the person may have difficulty expressing. You could then address their pain, offer them a snack, or reduce the surrounding noise. If you feel uncomfortable about the situation, don't hesitate to ask those around you or professionals for help. As many people living with neurocognitive disorders still remember events from the past but have forgotten the present, some may ask where their parents who have passed away long ago are, or want to return home to a place where they no longer live. In such situations, which may mask a need to be reassured, it's important to avoid trying to explain that it's not true or that it's not possible. Instead, sit close to the person and talk to them in a calm voice. Validate their emotions by saying something like, "I know you'd like to see your mother. She's not here, but she's safe." Or, "It's hard, isn't it, to be away from home?" Ask the person questions related to what they're telling you. Recalling memories will help them feel respected in their experience and reduce the intensities of their emotions. Then move on to a less emotional subject or distract them. When a person declines to take part in activities necessary to their well-being, it's important to make sure they understand what you're asking of them. You could, for example, use gestures or a picture of the task to clarify your request. If they persist in their decision, it's best to avoid insisting and instead propose the activity again a little later, or ask someone else to do it. Keep in mind that certain situations or discussions may test your limits. Don't hesitate to access resources that can support you, such as your local Alzheimer Society. Professionals can provide you with guidance in such situations.